Thank you very much. So welcome to this meeting of Children and Young People Scrutiny Committee. My name is Tony Fagan. I'm the chair of the committee. We've got Councillor Ben Proctor here, Councillor Highfield, Councillor Hitchener, Councillor Cornthwaite and Councillor Davis there. The agenda papers and other relevant information for the meeting are available for public viewing on the Herefordshire Council website. Council is making a recording of this meeting, which will be uploaded to the Council YouTube website at the earliest available opportunity. Other attendees are permitted to film, photograph and record our public meeting, providing it does not disrupt the business of the meeting. If you don't wish to be filmed or photographed, please identify yourself so that anyone making a recording can be aware. Thank you. To ensure the recording quality is maintained, could members speak as clearly as possible, keep background noise to a minimum, and ensure that mobile phones and other devices are turned to silent, including computers, please. Right, so have we got anybody joining us remotely today? No. We haven't got anybody coming. Okay, we've got that's Donna. So we've got a number of officers present, and thank you very much for coming. If you could introduce yourselves when you speak, that would be helpful. But I'll just say that we've got Rachel Gillett, who's the Service Director for Early Help, Children in Need and Safeguarding. We've got Natalie Solomon, who's the NHS Herefordshire and Worcestershire Integrated Care Board. And we've got Leanne Lowe, who is Detective Superintendent for West Mercia Police. So thank you for coming. Right, have we had any apologies for absence?
Yes, we've received apologies from the Corporate Director, Children and Young People, Tina Russell, and from Councillor Ivan Powell, the Cabinet Member for Children and Young People.
Thank you. And no other apologies. Do we have any named substitutes for committee members?
No, there have been no named substitutes.
Thank you. And do we have any declarations of interest from members in respect of any items on the agenda? No? Okay, so if we move to the minutes, can we approve and sign the minutes of the meeting held on the 10th of March 2026? I haven't been made aware of any proposed corrections for accuracy. Is everybody happy to agree the minutes? Fine, thank you. So I've got a copy here and I'll sign them. Moving on to questions from members of the public. Have we had any written questions from members of the public?
No, no questions have been received.
Thank you. And have we had any questions from members of the council?
No, no questions were received.
Okay, thank you. So that moves us to agenda item 7, which is the neglect strategy. So we've received the report for the committee to note advising of the Herefordshire Safeguarding Children Partnership response to neglect, and we've got Rachel Gillett here. And Rachel, if you would like to sort of talk us through the report, that would be great. Thank you.
Yeah, so I'm Rachel Gillett. I'm the Service Director for Safeguarding and Support. The paper sets out the response of the Safeguarding Partnership on a really tricky subject, which is neglect. It's probably the most pervasive form of neglect, pervasive form of abuse that a child suffers. It tends to be cumulative, and it is also one of the most difficult ones to evidence, but will have a significant impact on the child's development. Neglect is categorised in many different ways. There are the ones such as physical neglect or medical neglect, which has been an issue in Herefordshire in the past, where it's a failure to seek or follow medical advice. We've got educational neglect, where the child does not attend school or is prevented from having a good education. Emotional neglect, which is the absence of affection or being emotionally responsive. And then you've got combined supervisory neglect, where children are left unsupervised or put in inappropriate caregivers' care. And then environmental neglect, which I'll come to in a moment, which is unsafe or unsanitary living conditions. Many of these are interlinked and codependent, Families exist within a wider environmental and socio-economic situation which can cause significant stress to them. We're all aware of the increase and the challenges of the economic situation within the UK, poverty, limited resources, a lack of housing, particularly permanent housing, or where you've got families that have moved around, a lack of family support or wider family to help, which may well have been done traditionally. And this can all affect the food, clothing, toiletries, the lived experience of families within their homes. So one of the challenges that we have as a wider partnership is differentiating between intentional and unintentional neglect. For example, if you've got a family that are living in a bed and breakfast, it can be very difficult to evidence the child isn't getting sufficient nutrition, or if the family don't have cooking facilities, or say the child is placed in Ross-on-Wye but their school is in Herefordshire. That's a very significant journey backwards and forwards, and if they're on benefits, that can take a good proportion of those family benefits. So it is about the challenges that families are facing within our area and nationally, and how we differentiate between those which are caused by the environment or the socio-economic conditions and those that are caused by an omission or commission of behaviour of the families. That is not to say poverty is an excuse for neglect at all, but you can understand that that will bring challenges for families. One of the challenges for the partnership across many disciplines is identifying where that is. So if I put a link in to the website which shows a number of practical resources that health visitors or others can use, particularly schools, to identify where a child may be suffering neglect. These break down into a day in the life. So there is a day in the life of a 5-year-old, a day in the life of a 10-year-old, all different types, which people can go on to understand the challenges and the lived experience of the child, because that is the key purpose when we're investigating is neglect, is what is the key lived experience for those children. You'll have heard and seen, as I've written, about the Grady Care Profile, which is an in-depth review of the child's lived experience and that of the family. And by bringing together that information, you can more readily identify where a child is subject to neglect. We've trained over the last 2 to 3 years 800 practitioners in the Grady Care Profile across many different disciplines and safeguarding partners. There is also support and help for practitioners out there, both within their own safeguarding lead, so DSLs within the school, or within our MASH. There is key leads within MASH, which are at the end of a phone for teachers or health practitioners to phone in and say, I've got these thoughts about this child, what do you think? So that there is a way of staff getting support when they may identify neglect. But we also have key leads within their areas. One of the challenges we try to identify post Ofsted is are the resources that we've got on the website working for the practitioners that they're there to serve. The recent survey showed that for health and for children's social care, the return for that was yes, they found them very helpful. One of the returns from our education colleagues is they felt they were quite long and weren't necessarily supportive of them identifying neglect in a school. So one of our challenges moving forward, which is in track at the moment, is how we support our education colleagues to identify neglect for children within their schools. An audit that took place, there are audits that take place all the time, but a multi-agency audit that took place last year identified those children that were in neglect in 24-25 and those children who were in neglect at 25-26 to see the impact of the neglect strategy. And I've given the responses to that, in that there were significant changes seen. There were significant changes in the identification and the referrals for neglect, which was really positive to see, as well as an increase for children on neglect on child protection plans. What was also gratifying to see, which came the latter quarter, was the review of children on a child protection plan for neglect that were over 15 months. That showed a reduction of over 50% of those children who were on plans for over 15 months. And we also implemented that because of the pervasive nature of neglect, that no family should come off a plan after 3 months, because there won't have been enough time to test and challenge those families. Of the children that were on a plan for 15 months, 67% of those had the outcomes for the children were improved and the child protection plan ceased. They continue to be monitored on child in need, but fundamentally the outcomes for those children had improved. Just under 30% were subject to care proceedings or were accommodated, and then there were 5% where the child, young person, became 18 or transferred to a local authority. Within the paper, you can also see the response that our education colleagues gave in how they support schools to understand neglect, as well as ongoing training and forums and the number of practitioners that are attending those from many different schools to try and support them in understanding neglect. So that's where we're at. I'm going to pause before I go on to the peer review that we did with Birmingham.
Okay, thank you. Does anybody have any questions for Rachel at this point? No.
I'm sure we all have questions, but whether they are best asked now or later.
Yeah, if you don't mind, I mean, I think what you're saying to us, Rachel, is that there are significant challenges given the cost of living crisis, given the housing crisis that we're in, and that kind of distinguishing between poverty and intentional or non-intentional neglect is quite a challenge. That actually a targeted approach has been shown to have an impact, and that information is significant because it shows that we can actually make a difference to these children's lives. In terms of partnership working, that resource sharing, now we know that the partnership is in a more advanced position sort of over the last few years. I think there may be a question around kind of data sharing, and how do you make sure that you don't that there aren't GDPR issues in terms of data sharing, but that there is good partnership data sharing. And I think that comes in. Do you understand what I'm saying? Sorry.
I do. So working together, previous one and the recent one that was published in March 2026 has made it really clear there should be no obstacles for information sharing. Where a child is perceived to be at harm, the partnership shares data frequently. The response to neglect is overseen by the Quality and Effectiveness Group, which is a multi-agency group that sits as a subgroup under the Safeguarding Partnership, as well as over the last 12 months we have been sharing data with our colleagues in Worcestershire, so we compare what's happening in Herefordshire as well as what's happening in Worcestershire, because we share the same partners. So if we can identify an issue, it makes sense that we're all sitting together and trying to resolve it, rather than partners sitting duplicating those meetings. But more importantly, it helped us identify that for Section 47, that's where a child is deemed to be at risk of significant harm. Within Herefordshire, we had more joint investigations with the police than we did with Worcestershire. So it helped us to identify some of those challenges there and then rectify them. The data set that we review is a holistic data set. So it includes information from colleagues from Wye Valley as well as Worcester Health Trusts, and maybe admissions to. It includes admissions to accident and emergency. So how many injuries we're seeing with children, accident and emergencies, how many police powers of protection were taken, how many strip searches were undertaken across. But it looks at a whole range of data, which Birmingham are very jealous of us about, and allows us to identify and to pinpoint where there may be differences, but also where there may be increases, because we do it over a quarter, so we can begin to track those challenges and an increase in, say, neglect or sexual abuse or other aspects. So it isn't just looking at neglect, it's looking at all forms of abuse, but also wider early help support. And we do that on a quarterly basis. The other way we cross-reference is we get national data. So we've just, it came through today, the national data across the West Midlands. And so that looks at our contacts and referrals, and I'll talk through that for the peer review. And it allows us to benchmark, despite whatever the size is of the local authority, each person's response, each local authority's response to those challenges.
Okay. All right, thank you. We have got some questions here. So Councillor Highfield, then Councillor Hitchner, Councillor Cornthwaite, Councillor Proctor, Councillor Davis. There you go.
Me first. Yeah, first of all, I'd like to, the figures show that we're on the right track and congratulate you on that. The things are getting better. There's measurable figures. Unfortunately, I don't see graphs in these reams of paperwork we've got here. There could perhaps been a few graphs to show that to us instead of reading.
I'm happy to respond to that. My direction is don't add graphs into
Okay.
scrutiny papers, but I'm very happy to show
Well,
you
when
that.
you're,
I think at this committee, we've had exactly this conversation before, and that I think on behalf of the committee, I reiterate, we like graphs.
I will add graphs. I will send graphs. Very happy
Yeah.
to.
and the other thing I wanted to say was our general messaging to the broader community of people who deal with children in particular, are we making it clear that neglect of a child is absolutely unacceptable in this world? And it may not be their fault where they're being led into risk of neglecting their child, but if they're in that position, there are places they should go for help. They should ask for support. If we don't make it clear, if we're very sympathetic with the family, well, we know you're rather poor and you're struggling, that's still not an excuse for a child to be neglected. And I think that's a sort of message that we need to be quite strong about, because I'm afraid that some people don't realise until they're facing, a social worker or a police officer, that they put their child in an unacceptable situation. So are we being clear with that message? It's unacceptable for a child to be neglected, and if you can't avoid it because you don't have any money, for example, then you need to seek help urgently. And if you haven't sought help, then you are partly to blame for it.
So I'm going to answer that in two parts. So the first part of your question was around, are we being clear across as a county about what's acceptable and what's not acceptable and where people can go for help? The Children Wellbeing Bill has adapted and changed children's services. I'll explain it now, in that there is an expectation that families can come at any point now and they will get family help and support. We've cascaded that over the last 2 to 3 years with early help across the partnership, and we've also done forums across the county about how we can provide early help. And the challenge moving forward, and really positive change, is that change into family help, community development, talk community, which is being cascaded as we speak. So I think our families aware of the help and support they can get. We continue to cascade. There is going to be a national focus on neglect, which I think will help. So there will be national press. The government and the Safeguarding Partnerships Child Safeguarding Practice Review have just published a big paper on neglect. It came out in April 26, and that's going to be the focus of the government and safeguarding forums across the country. So I think it's going to help, where people will be talking about intentional and non-intentional neglect. Where it comes to those families where we are able to evidence that your child's lived experience is not improving, and when we believe that the change needs to happen, I think it's really clear at the beginning we work as a restorative service. So when we first go in, it is clearly about understanding the family situation, understanding the lived experience of the child, but also the lived experience of that family and their capacity to make the changes. And whether that is mental health challenges, whether it's benefits and they need benefits maximisation, so, support to help them get the right benefits and the best benefits, or whether it's connecting them to others that can support and help, and the family-based decision-making for family group conferences, we do all of that first. I mean, if the police walk in together and the house is completely uninhabitable and the children are living in a situation where none of us would want them to be, then we work together very quickly and very swiftly in order to address that. But for most of the neglect, it tends to be cumulative and over time. I think we've got much better at addressing that. I'm not going to sit here and say that every social worker or every person that works across our partnership is being absolutely 100% clear about what needs to happen, but that's about the training. That's about us currently moving forward as one to make sure we are being clear with families. One of the challenges with graded care profile, and as I've already noted with education, is the size of some of these documents can be prohibitive. If you bring a multi-agency chronology together, it can be, because of the different detail from police or from health or from ourselves, it'll have a lot of detail that's not necessarily specific and could be 100 pages. Our largest group of children that are subject to abuse is neglect. So we are working together with colleagues, with education, to bring a more concise type chronology that everybody can use. And I think that we're then going to present that to the Safeguarding Practice Review to say, we think this is a good way forward. What do you think? Because 100 pages for the majority of our children going through, it's not going to happen. But where you've got long-term cumulative neglect with, say, a large group of children, you know, a family group, those chronologies can help everybody understand in a group supervision. We've been changing our response to neglect over the last 12 months and have become more focused, more clear to families, particularly in our plans when they're on in pre-proceedings, but also evidencing, to be fair to families, we said that we were going to provide this. Have we? When was it provided? When did you attend, and what has been the outcomes? So we've got a lot better over the last 12 months, and Ofsted noted that and said the response was good when we got to those situations. What we found in the audit, and which Ofsted noted at the end of November, was where we'd got large family groups or where we had got older teenagers, we needed a different response. But many of those were down to medical neglect or to other aspects, and so our health colleagues at Wye Valley Trust, I'm sure Natalie can join in here, brought together a resource for a child psychologist to help with medical neglect. So if you've got a teenager that doesn't want to do their diabetes treatment, or a child that's got disordered eating, the psychologist can then help and support them through, as well as the family. So it's a wider response, really, in 3 parts.
Thank you very much. A very comprehensive answer. I still think that generally our message should be neglect of a child is unacceptable as a starting point for where we work from. But we had an interesting talk the other day from the school nursing service, NHS, and one of the things that came up out of that was that they can talk to children and they can be in confidence. The information they get from the child is in confidence. If they speak to their teacher, often it can't be in confidence. The teacher has to share that with the parents, and that is a barrier to children because often it's schools that see signs of problems and, may say to a child, have you had breakfast this morning? And the child doesn't want the message to go back to the parents. They don't want to involve the parents. It's difficult for them, but they might be more frank with the school nurses. And that problem of not being able to be confidential is a problem, because it's often the schools that spot what's going on earliest. They see the children every day. So is there any way around that issue?
I mean, I'm sure Natalie would talk, but it's very clear, both in working together 2023 and 2026, that if a child discusses with you something that would cause concern, you must report it. There is no such thing as total confidentiality.
Well, when there's a safeguarding concern, yes, but there are areas where, of course, it has to be shared.
Absolutely.
But the lady from the school's nursing service was very clear that there are other cases where they can help the child and the child will only speak up because they know it's in confidence. The only way they find out.
I think there might be something there around the relationship. There you go. Apologies, can you hear me now? Yes. Yeah, I think it might be about the relationships because school nurses, obviously, they come in sort of as an additional person to the school. So it creates a slightly different relationship, and also they kind of speak to children from a kind of a holistic point of view. So they ask them about, themselves, about what's like at home, how's school. Whereas at school, it can just be seen that your teacher's looking at you from an educational point of view. So I think it provides a different opening, perhaps, for a young person or for a child. But in terms of safeguarding, exactly what Rachel said, if there are safeguarding concerns, the professional would be expected to have a conversation with the young person and say, actually, this is what you've told me, this is what I'm concerned about, and this is what I need to do. And school nurses are aware of that. So I guess it just depends on the context of the information that's being shared and how that's being perceived as well.
Although health visitors and school nurses are our largest group now of practitioners doing early help support. So that's increased over the last 12 months.
And I think that link with early help is really, really important because, and I understand, Councillor Highfield, that what you say is unacceptable, but we have to remember that we are working within a restorative practice and relational working, so that support for families, which we're doing through the task and finish looking at that, is absolutely vital. And I imagine with something like neglect, it's sort of really, really crucial. So we've got Councillor Hitchner and then Councillor Cornthwaite.
Yes, thanks, Rachel, for that very interesting introduction and presentation. Just a couple of observations and then a couple of questions, if I may. Along with Councillor Highfield, I was very impressed with the school nursing service and the way in which they seem to be able to open up issues with children. And the one particular area that was of particular interest, I think, an example given really wasn't a safeguarding issue, it was something outside that. So it broadened the opportunity. I think as we do our task and finish group about early years, it's quite interesting as to how information about the community gets to the council or whoever it should be. So I think schools are the closest. GPs are second, but they, as is made clear in one of the reports, GPs only have 5 or 10 minutes with the, so they can't really go into any depth. And for me, the nursing service was a revelation when we had this presentation. I was very impressed with that. So one of my questions is the information isn't segmented between age groups, I don't think. And I'm curious as to the impact of private nurseries. So we have nurseries in the county which are part of primary schools, where I would hope that they're well covered by things like the NSPCC tool. But how do we deal with private nurseries, which there are quite a lot around the county? The training that's through the NSPCC tool, Rachel, is you've given the number of people who've been through it. What's the total universe? What sort of proportion has gone through so far? and in that context, the private nurseries might be an important element of that. And I'm also just curious as to the NSPCC tool seemed to me to be very good. I did actually listen to the video. I was very, very impressed with it. And I just wonder what happened before that tool was in place. Was it just the case that everything was very much more subjective, and what's come into place with this tool is a process where you can be pretty clear where the scoring should rate and be much less subjective? Hopefully you can find a couple of questions there. Thank you.
So I'll start with the first part in that private nurseries. So private nurseries are inspected just the same as our local authority nurseries. There is a dedicated team within our education department, which support and help nurseries and make sure that the training, they still have to have their statutory safeguarding training. As for how many and all of that, I'd have to come back. I don't have that detail to hand. When we talk about the 800 practitioners, one of the challenges that both Birmingham and ourselves had was, although we can identify how many practitioners have been trained in graded care profile, and I can say how many graded care profiles have been undertaken on our children within children's social care in a specific period, what I can't do is say how many have been undertaken across the partnership, and that was true. So that's one of our targets and one of our actions for the Ofsted plan over the next 3 to 6 months, to make sure that we can collect that information. That's also part of a wider Families First data set, which is an expectation of the government. So we've got these new expectations about how we meet certain aspects, and they're all being done at the same time. So that's why it's taking 3 to 6 months. As for the dedicated additional work for nurseries, nurseries are subject to the same safeguarding challenges, same LADO processes as everybody else. But I couldn't tell you how many of those have done graded care profiles at this time. But hopefully in 6 months I may be able to tell you that. So I'm hoping from that point forward we will be able to tell. The NSPCC tool, as you say, the graded care profile was first launched in 2018. And it was the first time that it looked as a child as a whole. So the lived experience of a child. It breaks it down into minutiae of a child's day. But it is very long. But it's a great tool if you want to evidence both to families but also to others that the child is suffering neglect. Were there specific tools before? Yes. Were they as good? No. But what we also know is that the work for children's services is based on research, the research in practice. There is ongoing work and adaptation to the tools. And as I say, the new safeguarding practice review, why did it take so long to respond, which came out in March, also talks about chronology, so cultural chronologies, which are particularly helpful when you're working with, say, a travelling family. So you can differentiate between those that they say is part of the travelling way of life and yet what is deemed as neglect. So the cultural chronology as well. So there are new tools coming out all the time. We have a focus and champions that are moving forward on it. And of course the multi-agency child protection teams, which we moved to in the 1st of July, will be seen as those that will be the experts and be able to move forward on some of this with dedicated time. So I think it's an exciting time for both the changes but also the research that's coming out for neglect, and having a national focus on it will help everybody see and families to see it as well.
It's one of the things I liked, Rachel, about the NSPCC thing was that it seemed the way it was communicated to the parent meant that the parent could actually improve their parenting skills almost without feeling criticised and damned or whatever. If the issue was about not feeding feeding your child appropriately, then there were tips as to how you could actually do that better. And it might be the parent didn't realise that these were better ways of doing things. But it must take quite a long time, I would imagine. One-to-one session with the parent. I don't know whether you want to comment on that. You mentioned the 100-page document.
So the chronologies can take a long time to bring together. The other aspect is we have an assessment now called Parent Assess, which many social workers are trained in, and that helps families to understand it. So it's a parenting type assessment which focuses on families that may have a learning disability or aren't able to cognitively understand, say, a written word, but can understand it in pictures. Both of those take time, both of those take relationships, but it can support a family to know exactly what they need to change in a way that can be evidence to them. But in most social work, it comes down to the trust, the relationships, and finding what works for some families and doesn't work for others. But both are very time consuming. But we have family support workers that are trained in it. and they can do some of the work. They can't do the parent assess, that has to be a qualified social worker. So it's about working out that someone will do the assessment and then somebody else might do the work alongside, because it takes intensive work to help them to do that. We have a number of specialist placements that can help a family when the child is newborn. That particularly now we've got more specialised provision in Hereford and Malvern and places close by, whereas 3 years ago we didn't. So we've built that resource and built the trust with the providers that will allow our families to be placed there, and for families to be placed where they know there are some challenges but we need to test it in a little bit more detail, to be close to their families where they can visit is a big change over the last 3 years, a big change. So I can't say that it's done. It isn't. We constantly learn. We constantly have to look at the new research, show what's gonna work, what isn't gonna work, and yet look at ourselves. So we've just reviewed our pre-proceedings and looked at two cases where the proceedings have been long-standing pre-proceedings. So that's prior to us issuing in court, evaluating them and saying what would have made the difference. If a child had 14 teeth removed, how did people not see that 12 months ago or 18 months ago? So it's about constant review, and as you know, our quality assurance framework allows us to do that, to quickly see where there's a challenge, go in, review it quickly, and then come out and then say, right, what do we need to change now? So yeah, we're constantly learning, constantly.
Thank you. Councillor Cornthwaite.
Yeah, I was just going to ask about the number of people you graded care profile, those under training. I think you've quoted that figure of 876. Is that a regional figure, a national figure, an English figure?
No, that's for those who've been trained in Herefordshire.
Herefordshire alone?
Yeah.
That's amazing. And then the other thing I was thinking about was a family comes into Herefordshire, determined to live a very low profile life with their children. How quickly would we pick up on the fact that a child could be in a situation where they weren't going to school, and so therefore they weren't being sent to the doctors or the hospital? How long would it take us to find out that we had responsibilities for a child that nobody knew about?
Okay, so we do have a number of families that come to Herefordshire that are trying to remain off grid. So there are a number, particularly where perhaps it's not uncommon. So they travel from Worcestershire, travel from Warwickshire, may travel around, and I'm not talking about travellers here. I'm talking about families moving around with children. And our MASH is excellent at identifying those families if a referral comes through. So I'm not going to say they're Miss Marple, but they're not far off. Particularly where we have constant contact with Worcestershire and Warwickshire to try and find out if there's something that comes through and there's a concern. How do we find out? Particularly, we've had no contact with them before, or no one's able to tell us where they were before. The majority come from the hospitals. So the majority come from the hospitals and our health representative. They also have identification, don't they? Or where you've got somebody might phone up and say, this family, I've not seen them. That happens a lot. We have a chat line. Do you know about the chat line? Where the chat line is for any member of the public who can phone up and say, I'm a little bit concerned, or I don't really know, or I don't want to get them into trouble, but... So there's somewhere that they can phone and can talk it out and tease it out. So they might say, this family come, I don't see them go to school, I don't see that. And then the MASH will then start to dig a little bit. And the names will come up from previous, if they've never been on grid, so they've never had a doctor, which would be very difficult now with registrations of birth. But if they've never had it, then it will be more difficult. But people within Herefordshire and across the country do become curious. They do become curious, but I can't, if it comes in contact with health, or it comes in contact with a school, but if they're home educating, you have to by law notify that you're home educating. There's going to be a change in the Children Wellbeing Bill, which is absolutely great. It's a statutory requirement that families will need to tell us. At the moment they don't. It's kind of voluntary, but at the moment they in the forthcoming Children Wellbeing Bill, which just got royal assent, they will. But it tends to be there's a lot of communities in Herefordshire, a lot of close-knit communities that also notice people that have come in from elsewhere. You've only got to see a group of travellers come to see all the notifications that come from lots of different places. So I think we're a lot better, but there'll always be a family here and there that if they really truly want to stay off grid, then they will until somebody picks up and contacts us. Or they might contact a school, or they might contact health. There's also community policing, but that's not going to help in some of these off-grid areas, is it? No. But Herefordshire is great for community. There's only 190,000 people.
Okay, Councillor Proctor, you had a question, and then Councillor Davis.
If I may, I have two small questions and one big question. So the first small question is this figure for the number that have been trained, which Councillor Cornthwaite thought was great. I want to pick up on Councillor Hitchinen's point, which was, so my question, whenever I see a number like that, is it a big number? And this comes up a lot. So we get stats about how many people have been trained, but the more interesting question is how many people do we think should be trained? And I accept that's probably not very simple to answer, and there's probably sort of different groups. So I imagine for something like this, social workers, school nurses, health visitors, we would definitely want them to be trained in this, and then perhaps DSLs in school, but then there might be other people for whom it would be desirable. And so, do we have a way of understanding, not just for this, but this is an example of how many practitioners we think should be trained in any given tool, and then how many actually are trained in that tool?
So I think 870 is a phenomenal amount. It's an extraordinary amount when you consider how many practitioners work in Herefordshire. I think it's a really positive number that have been trained. How many use it, or how many have subsequently gone on to do a graded care profile? That is the question, really, and that's the question that we're looking at moving forward, so that we can see that you've done the training, you understand what it means, and even if they've done the training and don't use it, the training for neglect and identifying it is still great training, because it's NSPCC training. So I think it's a really positive number. On the last training in the last quarter, 25 or 22 to 25, forgive me, practitioners were being trained in the graded care profile, and over time we've seen, obviously quite clearly as you would, a reduction in those new starters or others being trained in it. But we did do a review recently of the practitioners, and did they think it was a good piece of training, and has it helped and support them to understand neglect? And yes, it did. But until we get that actual clear detail about who is doing the graded care profiles, how many are being done, and what impact it has, because numbers are numbers until you see the impact. Well, we don't know. So we don't know at this time, but we can't go back and say you did 800. We've had 800 people trained. How many of you then did a graded care profile? We won't be able to do that, but we will be able to do it moving forward. But 800 is a very positive number. The partnership did well.
Natalie, you look like you wanted to respond there.
Oh, go on. That's okay. Just in terms of health, so all health organisations obviously have responsibility to make sure that all our staff are trained within safeguarding. So for health visitor school nurses and any sort of nurse practitioners that are having direct contact with young people, children and families, we would expect that they are trained to safeguarding level 3. So that comes from like national guidance. So whenever new staff start within health organisations and within primary care, we expect that they will have that safeguarding level 3 training, which includes neglect. It doesn't go into the specific detail like the NSPCC training would do, but it does give them the basics of what you need to look for when you need to refer. So whenever we look at sort of training strategies within health, we look at how many staff require the training at that level. So, for example, as part of a partnership now within the data set that we're talking about, that Rachel spoke about, we could, for example, start giving that information and saying, right, we have X amount of numbers of staff that need training. These are the numbers that have been trained, and these are the ones that haven't been. And then, as you say, Rachel, we could then start to look at actually, well, how many of you have done that training and how many have actually then gone on to use the tools? So there are ways. I just think it's in its infancy at the moment, and these are things that we will sort of build on. But we have got that baseline for health.
So it was that I was really trying to. This is coming from the based on the assumption that we're a good service, we're a good partnership. So this is kind of like what next sort of question, and what Natalie's just said is what I would assume that the police would be able to say the same sort of thing. So here are the police officers and police staff who we would expect to be trained to this level, and these are the ones that have, and these are the ones that haven't. The council to be able to do it with its own employees, but then also obviously the partnership gets much wider. And so my question really is, as a partnership, how well are we able to understand who should be trained and who has been trained? And I accept also Rachel's point that the training isn't really the point, it's whether they're using it. But as a starting point, how well is the partnership able to understand, like, who are the people in the system who haven't been trained yet?
So we can, it's a national requirement for police and across health to have the safeguarding training up to level 3, and we review that data as part of the neglect and wider data set. It wouldn't necessarily be a specific piece of training. I'm sure Leanne will talk to this for the police. They wouldn't be filling in those type of profiles. It's more your health visitors and social workers. So it's about how do we train for neglect and for abuse per se. And then so I know that our health colleagues will say how many have had the training, how many have had a safe recruitment training. It even goes down to things like that, like safer recruitment training. We can definitely answer that one. It just becomes more nuanced when it's a specific tool to be used rather than a wider expectation of safeguarding training.
Can I just ask, do you have another question based on that training? Were you going to follow on with that?
No.
Can I just interject, and then I'll come back to you, and I haven't forgotten about you, Councillor Davis. Just on the looking at the NSPC website, and they had a graded care profile to antenatal tool there, and there were some case studies, and it struck me that one of the issues in Herefordshire, and correct me if I'm wrong, is that what's been identified through health is self-neglect in expectant mothers. So I would have thought then that a graded care profile to antenatal would be a really useful tool for midwives to use, and I was just wondering, is that something that potentially we could put down as a recommendation, given that obviously the resources are limited. I know that when we spoke to the midwives, there are issues around some of the optional training because everybody's very rushed. They really get to see parents on a very limited basis, and it feels like that would be a good tool to assist with that issue about self-neglect and then neglect sort of for expectant families. Given that what's obvious about neglect is a lot of it is sort of comes across generations. So if you've got people that have never had a good experience of parenting. They're not going to have anything within them that suggests that they could parent well. So having that guidance and support. Now I know that guidance and support from health from midwives would probably be quite useful, because although a referral would be made to social care if they felt somebody was unable to cope, it was things like sort of what expecting baby and now that baby's here, and those, that kind of support that is additional. I'm not sure what you think about that, Natalie.
Yeah, so the general consensus and feedback that we've had back in health around midwives using the tool is that it's more aligned to community roles such as health visiting and school nursing. I feel that it's more pertinent there. So we are having some challenges in terms of getting the accessible training, getting the midwives to do that. But we are looking at that wider as a partnership. And we're looking at trying to see if there's any other way we can either get them to adapt to use this tool, or whether we need to look at something else, which is what Rachel alluded to earlier in terms of it's the length and the time and the training. So we are aware that it's an issue, but we haven't quite delved into the detail of what those challenges and barriers are. So that's something that we did say we will have as a priority moving forward, because we do realise that that's a gap for us as well.
But what I will say is that our colleagues at Wye Valley Trust have made 2 referrals over the last 2 quarters to adults for self-neglect for a parent. So although it links to us, it also links to the adult safeguarding, because you're making a referral for an adult. So they are aware, they are doing it, but we've got to find a way that allows practitioners that have more reduced resources having to do more, and health expectations has also increased significantly by the government in March. Everyone's still going through that in a way that allows them to do it in their day jobs. But it is a good tool, but whether it's possible in the midwifery as the challenges are at the moment, we don't think so.
Oh, okay, well, but I mean, that doesn't stop us putting it as a recommendation, does it? And because it does look like a good tool. And okay, back to your question, Councillor Proctor.
My previous question was the first of my short questions, so this is the second of my short questions. But it does follow on from that specific discussion. So, so it feels like there are a set of professionals within the system who, like we've just touched on, like midwives in clinic, GPs, DSLs, where the sort of amount of time that they may have to kind of, I've got concerns about this situation, and I need to kind of find out more about the situation and then make a refer, is quite constrained, and so it feels like, for me, it's a sort of design question for all of those different sorts of people. Like, what is the design of a thing that would help them, because they want to make the referral and that at the right time, but they're operating in their context. So are we, or can we take a kind of design-led approach to designing something that works for them in their safeguarding responsibilities?
So I think there are resources on the website which allows someone to do a short piece of work to try and identify, as I said at the beginning, a day in the life of a child. So they have a concern, a DSL, a safeguarding lead in a school would be able to do that nice piece of work to try and identify it. I think the challenge comes when we're looking at Grady care profiles and the tool that's been used for a long time, which needs to be adapted. So we're adapting it for ourselves. Natalie and partners are adapting it for health, and then we're also talking to education how we adapt it to allow them to pull together some of the wider information that allows us to see more pernicious neglect. So if you want to identify a day in the life of a child, there are lots of resources, but it's that the use of a specific tool may not bring the outcomes that we want it to, and that's what we're reviewing and are leading on in Herefordshire. We're leading on that, As for some of the other aspects, it's part of our Ofsted action plan about what's on the website. Is it being used for? We did the first part of the survey. The next part is going through each one. Is this still useful? Is it still relevant? You know, is it still enabling somebody to work with it? And that's a wider piece of work across all of our websites. Have I answered it for you?
Yeah, let's say yes.
What's missing?
And my big question is, I'd just like to explore the link between poverty and neglect a bit more. So, if I understood what you were saying, I think that you're regarding poverty as like a potential risk factor. So, the fact that people are poor. So, I guess my overarching question is, we do have families living in children living in absolute poverty in this county. Is that in itself leading to harm to children, or is it a contributory factor or a risk factor? Is that?
Many parents who are suffering challenging economic situations parent extremely well and do remarkably in very challenging situations. The challenge can be when you've got a situation that appears neglectful, but you can't necessarily evidence it because of the challenges around it. What we do in those cases, and we've had to do, if you've got a family that are in being bed and breakfast or are in accommodation that it just isn't fit, we rehouse them at the expense of Children's Services so that we can assess them accurately. But there are many parents. It can be a contributing factor for those assessments. As I said, if I use an example, you've got a family that are in temporary accommodation. You've got 5 children sharing one bedroom and a small bedroom. They have to travel from Ross on Wye to get to Herefordshire. That takes an awful lot of their economic money. They might not be able to get to the food banks. They can't afford the uniform, but the school gives them uniform and others. If that doesn't make change over a significant period of time and they can't sustain it, that's neglect.
And I guess, so I have 2 questions coming off that. So one is slightly selfishly, Councillor Cornthwaite and I are involved in Task Finish Group looking at inequality in the county. And so my one question is, do you think the wider kind of strategies in the county that might address things like inequality and poverty are kind of are recognising this link sufficiently, so that are we doing enough to stop that problem happening for families?
I think it's a wider, bigger discussion which people may not necessarily connect that poverty and inequality to the consequences which can be pervasive for young children. So I think it's a wider, bigger conversation. I didn't present the neglect maps, but we track the number of children who are identified as suffering neglect in different parts of the county and have tracked them over 24-25 and over 25-26, and we can see shifts in particular areas where we think we've seen, because we're still analysing them, where we've seen additional support go into those areas. Anything that supports families to not escalate has got to be a positive thing.
I'm sure we would like maps as much as we would like graphs.
I can't provide those maps. In fact, it was deemed to be sensitive, but I'm very happy to show Scrutiny members and send them to Scrutiny members, but to have them out in the public would not be appropriate. So we did discuss this, but it's too sensitive to put out.
Thank you. And I think also that in terms of emotional neglect, there is that neglect that hides under the radar, doesn't it, with the more affluent families? And I think that that's a sort of different area that possibly we can discuss at some point, because it seems to link in well with the whole issue of adolescent neglect and what's happening with our teenagers. But I did promise Councillor Davis he would have a chance to ask a question.
Thank you, Chair. Can I start with a question on training? Part of the training that's being provided, the 876 practitioners, is that training lifed? Does it have a lifespan for that individual? Because you may find you've trained somebody who then does not get directly involved with within that particular area, and consequently doesn't maintain that experience. So the currency and competency doesn't remain there. So I just wondered, is there a refresher point where they need to come back and do it again? And I just thought I'd ask that question first.
So the graded care profile, which is a specific tool to be used, is, as I've said earlier, it is a way of enabling people to see the challenges and the impact on children. That is not something that has to be renewed, but across the partnership, your safeguarding training, particularly level 3, does. So we can check and challenge on that. It does have a lifespan. It does have a time scale, but for the rest, it's all about awareness. Neglect is about, more than anything, awareness and helping people to see and to be curious and to try and see the different challenges together, because it is so pervasive when you're talking about emotional neglect, or they're not in school, or the neglect where they're not being given food. It's about being curious across the piece. When someone presents at a GP, when somebody presents at a maternity unit, and I can say, because it's been very positive to see the midwives and others referring now for self-neglect for adults. So it is getting out there, but the only training that is deemed to be one that's got a lifespan is the safeguarding training, isn't it?
Thank you for that one. Moving forward, the neglect being broken into intentional and unintentional, is there a thought that initially all neglect is unintentional until proved otherwise, and then the intentional neglect could then be broken down into circumstances, lifestyle, finances, all, you know, the whole myriad of things? So how difficult is that to try and identify?
It's really interesting, because the World Health Organization's definition of neglect is it can't happen if someone's in poverty. You then have different thresholds across across different legislation, across different guidance. The Children Wellbeing Bill and the response from the Child Safeguarding Practice Review is they're going to issue new guidance on what can be deemed as neglect and the challenges between intentional and unintentional, because this is a national challenge. The neglect is neglect if a child's outcomes are not improving, whether that's through school or emotionally and other aspects. Does the current situation on a family impact upon them? Absolutely, 100% it does, as it would for all of us. But when you break it down, when you've got your physical, medical, educational, it is about looking at that as the whole and then identifying what is the lived experience for that child. So yes, they might have family that are, for want of a better term, stressed. There's no one in work, you know, there's some relationship challenges. But if they're not being fed and they're not going to bed and they're not in school the next day, that constitutes neglect. But there'll be many families where you've got those challenges and it's not neglect. But we have to all look, be curious and analyse.
Thanks. Finally, the data that you gather that's improved so well, and you've done such a good job over the last couple of years of bringing these cases down. I take your main referrals are from NHS, police, schools, chatline, those kind of areas. Is there a particular area that brings in more cases than others? I mean, do we get better reporting, for argument's sake, from schools than from NHS and police, or from chatline, or is chatline better? Where does our main data source come from for referrals? I don't know if you can elaborate on that at all.
I can. So all the data that comes through the front door is classed as a contact, and then it's our conversion to referrals. We have different agencies at different times have a better conversion rate for those referrals, but the conversion rate is through to those that are classed as a referral for children's services. But many of those referrals will still be a piece of information, and say we get 3 referrals, we'll then review that again. So 3 contacts, apologies, 3 contacts. So each little piece of information is vitally important, and particularly to go back to somebody else's question, forgive me, about how would someone be identified. It's kind of this is how we analyse it. Our data is viewed every month, every quarter across the partnership, as in conversion rates from contacts to referrals. Our 3 main areas are police, because you'll have domestic violence. Obviously the police will get involved. Our second highest is actually health as the conversion rate, and the third is schools. But they kind of ebb and flow. I'm not going to say schools are better than health or health are better than it. It's different times of the year. And we inevitably get more referrals just after a school holiday and just before a school holiday. Okay.
Yes, Councillor
Just in
Hackett.
response to something you said, was that the WHO that are saying it can't be classified as neglect if the family is in poverty? I hope we don't follow that guidance. No. Okay, thank you, because it's ridiculous.
My mic's on. No, we don't. It's just an it's a debate that's going on nationally and across the world about the challenges of poverty on families. But no, we don't follow that.
Good, thank you.
Okay, thank you. And we are going to get to the peer review, but I have so I have a question around sort of policing. So sort of what would a sort of typical referral for neglect look like? How would that come through the police? What are we seeing in Herefordshire that's sort of quite typical?
That's really tricky to answer in terms of what's typical, but certainly what police officers will report on is they might get sent to an incident that's nothing to do with a child, for instance a burglary, and they will walk through the door and will see dog feces on the floor, unsanitary conditions, and then a baby in a cot. They'll report that as potential child neglect, and then what it's for us to do as a partnership is to work through, right, for the police officers immediately, is that child safe, or do we need to take immediate action to safeguard that child? Can we pause and phone our partners and talk the issues through and get a social worker out? Or is it safe for them to walk away? And they need to make that assessment whilst they're at the scene, suggesting that if it's that much of a mess, it's not safe for them to walk away. And then they will do a referral into what is the police vulnerability hub, where there are people that review referrals from policing and make decisions about referrals out to our partners. They'll call them contacts, we still call them referrals, so we'll make a referral out to our partners, and then a discussion will take place, a strategy discussion will take place around that particular family. So it's really hard. They are making referrals all the time. We are really pushing with them that professional curiosity when you're out at an address or with a child. Is that child safe? Do you need to make a referral? I don't know if that answers your question, but I can't typically say, and this is everything that we see around neglect, because it's so such a broad topic.
And I think that this probably will come up in the next agenda item, that how that vulnerability hub is working, yeah, and sort of how those sort of referrals, those changes in referrals and the different way in working. But thank you. And the other question that I have always is about the adolescents and the teenagers, because we know that adolescent neglect was emerging pre-COVID, and that sort of since COVID, that whole issue about emotional neglect and emotional health, we're seeing it in the Task and Finish. The schools are saying it about the lack of resilience within adolescents emotionally. Now, there is, that I know that there are issues around CAMS, and a lot of people feel like a lot of the emotional issues should be referred to CAMS, and CAMS is going, well, this is not a mental health issue. But surely all those families aren't emotionally neglecting their children, or is there a crisis in parenting where actually people don't sort of have the proper tools to be able to parent their children through adolescence in a sort of strong and resilient way? And is that something that the sort of health partners are looking at and trying to address, aside from the CAMS issue? Because I suspect that what happens is that if you have emotionally disturbed adolescents who are struggling, the impact of that is massive. So is this something, Natalie, that the health partners, given the constraints, we understand that, but that you're looking at with seriousness?
It's something that we've been looking at really in terms of mental health provision. So nationally, we know there's been lots of investment, don't we, from the government around mental health services as a whole, and through the Families Partnership work that we're doing now in terms of early help, family help. A lot of that is around how adult mental health, so parental mental health, impacts on the children and the wider family. And through Families First, it's going to connect parenting more with children and the impact, and that'll include adolescents as well. But also, we've been working with some of, like our local health partner, Hereford and Worcestershire Healthcare Trust, around their development with the West teams, which are in schools. So they're sort of looking at rolling that out across Hereford and Worcestershire to make sure that children that don't quite meet the threshold for CAMS or have behavioural issues or sort of low emotional health needs, that they can connect via the schools and have a wraparound approach. Now, we know that there's only been a sort of a specific funding applied, and we've kind of done that in specific areas across the patch, but it is going to be rolled out. So there's a wider piece of work taking place currently to look at that, and then obviously that will feed into the partnership as well through the FFP Families First partnership work as well. So it's in its infancy really, but we are working as commissioners around that with our partners.
Thanks. Because some of the information I was reading was suggesting that there's a really strong role for public health here, and I wondered if we're looking at that also in Herefordshire, that to be sort of public health become a sort of partner in this, because although some of the issues are, you have to be careful not to conflate them, but they are neglecting, in terms of self-harming, school refuses. The list is sort of endless. That it's what a lot of our adolescents are experiencing. So I think that there was somewhere I read about public health getting involved in delivering parenting courses to help make parents more sort of resilient, and for them to be able to identify where additional emotional support is needed for their children.
So we Children's Services, we now have Lindsay McCardle, who is funded by Public Health, and she is also looking at the youth strategy and other aspects. And as you'll know, Tina is interested as well as the impact on COVID and children and young people. Specifically, they have provided us with emotional health and wellbeing workers, so they're going to fund that within our new multi-agency teams. And they are looking at it as a wider issue. Now, we know that the impact of COVID is subject to research nationally. I think we will see what happens nationally to see whether it then falls within public health or falls within children's services. The Emotional Health and Wellbeing Board that oversees all of this would probably be able to give a more in-depth response to this. But what I can say is it is a key focus, obviously, because of the impact on CAMS and those threshold challenges where you've still got young people who are presenting at Wye Valley Trust, accident and emergency, and other areas. But I would still say there are many young people who are healthy, happy and doing well. It is perhaps a reporting which is also impacting, but then also the impact of social media and other bits. So I think it's a wider, bigger issue, which I think Emotional Health and Wellbeing Board are addressing.
Okay, and there was a question for me around the numbers, because somewhere in the report it said that you know the referrals had increased, which was a good thing because of the awareness around neglect was obviously there. But and I was thinking, well, is it about the awareness, or is it about the fact that actually cases of neglect are on the increase? Because or is it just generally that across the board people are much more aware of the issues that constitute neglect? Do you understand what I mean?
I absolutely, and it, you know, it's the judgment of Solomon. Is it one or is it the other? What I'd rather have is more early intervention, which is what's happening. So our numbers in child in need went up. And when we get to the peer review, you'll see that our numbers in child in need are greater than those of Birmingham, per se. So the earlier we get in, the more that the impact of the child will be lessened. Of course, it will. The work that people do in education, etc., is also getting in there at an earlier point. We also know from other reports and other scrutiny reports that the families receiving early help has also increased. But for those children who meet the criteria of a child protection plan, it is then about how effective that plan is and what are the outcomes afterwards. The outcomes, as we're analysing them at the moment, and as I've said, I put Codicil on that we continue to analyse them, is that the majority step away from plans and remain off a plan. Those that are on a child protection plan at the moment, for those that have been re-referred, the majority are from 4 years ago. So they managed to sustain for 4 years and have now been referred. We can't say inevitably the situation and the way people live will have an impact on people. But we need to get in earlier, and we need to give families that support and help earlier, so that when it gets to a point that tips over to neglect and pernicious neglect, that we can act swiftly.
Thank you. Yeah, Councillor Proctor.
That discussion, this may be going off in a complete tangent, but that discussion made me the further you go up the kind of earlier intervention, more prevention, the more you're talking about public health style interventions. And so not just so if we think of neglect as a whole, is it something where we should be thinking about it as a public health question?
I mean, I would say so, considering what we know about the family's lived experience at the moment. It would be for public health themselves who would be able to respond to this in much more detail, and they may well have more detail than ourselves. But I think for many aspects, as we do with domestic violence and other aspects, we look at it as a wider council.
But I mean, I'm sure we can talk to public health, but I guess my question is, are you talking to your colleagues in public health about this as a public health challenge? Do you expect the cabinet member to be talking to his fellow cabinet members about this being a public health challenge? Obviously, when children are subject to neglect, then it becomes a social care challenge. But are we as a county seeing this as a public health challenge from your perspective?
So where we talked about adolescent mental health and when it comes to that kind of challenge, absolutely. Public health now sit there are representatives from public health which sit under the children's services umbrella. So that's a positive way forward. I know that we're talking to Councillor Gandhi and others about the housing challenges, and we're working together with our housing colleagues regarding how we do that. I think it's a whole council challenge that we're talking to lots of different council members. Are we talking specifically to public health about some of the issues in COVID and those bits? Not necessarily, because that sits underneath the Emotional Health and Wellbeing Board, and you have to make sure that those that can address it in a wider perspective, we're not duplicating, because that's what happened previously. So we don't stay in our lanes, but what we do is make sure that those are able to give a full and active response. So that's what I mean by that. But as for working together and across councillors and members and different departments, absolutely we are.
So, in terms of neglect, what should we be looking for over the years from that whole council response?
So I think if everybody is curious, understands the concept of neglect, understands, as we've done today, explain to you the difference between unintentional and intentional. This is a newer conversation that's happening across the government with the Child and Wellbeing Bill. It's happening with the new JTI, so that's the Joint Targeted Area Inspection. For the next topic is going to be neglect. It's currently sexual abuse. Previous to that, it was domestic abuse. Now it's neglect. I think it's a wider conversation that's going out across both yourselves as a political agenda, but across the council as a wide issue. The same comes down to any child that is subject to a child protection plan. That's everybody's responsibility. You know, it's for everybody to come together and to challenge that. I think it's going to be a wider conversation over the next 12 months. I think it'll be led by government, as well as safeguarding practice reviews, as well as research in practice, as well as us as a council. As us as a council trying to address some of the challenges that I've talked about today, we are liaising with other council members and, as I said, public health within our group. As for me stating, are we going to go into public health? That's not for me. That's not for me to say. That is actually for public health to come back and give their response.
Okay, thank you. I think it's a good question for us to ask, actually, because it seems that the issues, that there's a strong correlation between them. Rachel, would you like to tell us about the peer review with Birmingham? Was it Birmingham? Yeah.
It was Birmingham, yes. So when the largest local
Do you want to put your speaker on? Sorry.
So when one of the smallest local authorities and when one of the largest local authorities were paired together as partners for the peer review, there was some surprise. The peer review is done across the West Midlands, where the assistant directors of children's services are paired together with another local authority. The two local authorities get together, and then they say, what would you like to discuss together? And both Birmingham and ourselves chose neglect. So we did a review of each other's strategies, tools, data, and then came together to check and challenge each other in a big session, together with everybody there, wasn't it? And we were the only review that brought partners along. So in all other local authorities, they didn't bring partners along. We got lots of brownie points for that. But it was a very interesting way of looking. Now, I've only included 8 slides. You don't need the 20. And within that, we looked at some of the heat maps and other aspects. But it was a way of 2 local authorities looking at both their data, but also how they address neglect. But what are they doing that's amazing, and what are they doing that needs, that we could pinch and borrow with pride from others. I think from the slide pack that I included, you can see that although Birmingham is it's the biggest local authority in Europe, you can see that some of the data is similar. You could also see some of the challenges that were similar. By doing it per 10,000, it helps you to see the level that we're both working at. Within that, you can see that we have less children on child protection plan per 10,000, and we have more children on a child in need plan, which is a good way round to have it. I'll allow my health colleagues and my police colleagues to talk in a minute, but what was seen as strengths was clear multi-agency commitment to tackling neglect, well-established tools. One of the things that Birmingham had, which we are definitely going to borrow with pride and have borrowed with pride, is the champions. So they have a champions network of passionate people which go into the teams and are part of the teams and can champion neglect. So we're copying that with pride. They are copying our heat maps. So they didn't have the heat maps or the way of tracking neglect across their areas. There was a good response as well we had a child safeguarding practice review for a child with diabetes, which brought about the psychologist, which they hadn't done that, and the increase in the 2 current reviews that we're looking at the moment for adult neglect when they're connected to children. They thought our data set was also extremely good, but what we both suffered from was gaps in some of that data for Grady care profile, working with large family groups. So where you've got a child that may be 3 and a child that's an adolescent at 16, and how do you evidence and differentiate between those challenges of neglect, and then the poverty issue, which we've talked at length about today, and the rurality in Hereford, which means that services can be more challenging to gain. But for Birmingham, it was actually having the capacity of services. So there might be a lot, but they have long waiting lists. I think my health colleague and police would like to talk about their neglect part of that, wouldn't you? Come on, you're doing some good stuff. Come on, you're doing some good stuff.
Yeah, from a policing point of view, we talked about the use of police protection power, so that where the police see a child in an incident where we wouldn't walk away, we take them into police protection, and that's actually quite low in Herefordshire, low numbers. And we talked about things that West Mercia Police have done with our other local authorities, such as a multi-agency review of those powers, where we're using them more often. But I think we negated that as a potential tool here. What we have tried to do is increase the joint investigations that we do at Section 47, so at child protection. So I think historically, policing has let children's services do single agency investigations, and that's not always right and proper. So those have gone up by 50%. That data's on Q2 of 25-26, but a 50% increase in Herefordshire of joint Section 47 investigations that we do with our partners. Talking about training, so across the country, student officers receive mandatory training around child neglect, and then our specialist investigators, they get an input on their detectives course, and then they also get a specialist child abuse investigation course that they do. Now, not every specialist investigator has that, but we do track it as a force to try and get ourselves somewhere near 90% of the workforce being trained in that specialist child abuse investigation course. We do disseminate child safeguarding practice reviews, and our officers are aware of the toolkits. I can't hand on heart say that they use them, but they will be aware that they exist on Herefordshire's site. I'll talk a bit more later when we talk about the VHub, but we've really pushed the voice of the child in West Mercia Police. We've had a massive campaign running for about a year now, and we drip it out so that it's never forgotten. We use mnemonics to help children, to help police officers record the voice of the child, and we're constantly reviewing that and how we can help officers to do better child risk assessment, so that when the VHub are talking to our partners, it's on a sound footing. We've talked about neglect can be sometimes subjective when officers go, and like the rest of the country, police officers have different standards within their own family lives, and so we have to try and give them a standard. Well, this is the stuff that you're looking for. These are the things that you need to be curious about within an address when you go, for whatever reason that you're there. We do record and track our outcome rates. We can't track child neglect on its own. We can only track that's really hard to say, track child cruelty in terms of those outcomes at the moment. So that will take in willful assault, ill treatment, neglect. And we also track when, if a partner intervenes and takes some action. So if we go out and do a joint visit, but that we all agree, actually, this family doesn't need a criminal outcome, what it needs is some help, then we record those outcomes as an outcome 20, which we also track. There's a perceived low charge rate for child neglect, but I think, as Rachel has very well pointed out, that often criminalising a family is not the right thing to do. But we do take criminal action where that's needed and required. Just reading through. Again, there's some slides there on VHub, but I think, thinking of time, we're going to talk about that shortly, so I'll pass over to Natalie.
Hi everyone. Just to give some back context to this, so it's the Wye Valley Trust that have provided this information based on the fact that they're the health provider for us in Herefordshire. So they have two trainers within the trust that train all the staff around the graded care profiling. So they've made them their champions for the trust to make sure that they're out giving the staff the background and the information and being that point of contact for staff to be appropriately trained across the trust. The health visiting and school nursing teams have also had neglect and the training as well. Obviously, they're the front-facing staff within communities where they can go into homes and they have that universal contact with families. So that puts them in a really valuable position, really, to have that first insight into any sort of signs of neglect as indicators. They held an annual conference last year around adolescent neglect, and that was quite successful as well. So they engaged really well with their staff on site to get them to understand around adolescent neglect and to also to be part of their safeguarding level 3 training as well. There was a CSPR case that Rachel's already referred to around medical neglect in terms of a child that had diabetes and was, because of his adolescence, he was refusing to take his medication. And it meant that he became acutely unwell. And as part of that, one of the aspects of the learning review was that there was an identified gap within being able to access mental health support, is what he needed at the time. So what was identified that was in line with the NICE guidance of the National Institute of Clinical Excellence guidance was that there needed to be a clinical psychologist in place within the trust to be able to for children to be able to access with diabetes. So that has actually now been put in place of 15 hours per week to support children. As Rachel's already identified and spoke about, the self-neglect is an indicator for parents, and it's being identified more in maternity staff. Think Family has been around for a number of years, and that's just encouraging all members of staff, whether you are child registered, you work predominantly with children, or whether you work predominantly with adults, to see the family as a whole and not to see families as separate, because obviously there's all ages across families. So the Trust have been working to try and encourage all staff to identify safeguarding, not just within children or in adults, but how it impacts on the whole family. So there's been a lot of work around that as well. There's been an increase in the number of practitioners that have taken on the role of lead practitioner, where there's identified sort of low-level sort of safeguarding concerns to prevent it getting to a Section 47 or child protection. So lots of health leads are now sort of seeing it as part of their role, as opposed to, we'll just make this referral to children's services and that's us done. They're really understanding, and that's part of their core role and responsibility as well. The Trust have got a safeguarding supervision policy that's in place. So for individuals or staff that have got concerns around cases, they have regular supervision from a named specialist worker that can speak to them about specific safeguarding cases and just make sure that they have that protected time to speak about those cases in more detail. And the paediatric staff have started to use something called the Voice of the Child Toolkit, and that's to try and capture the voice of the child as well as any additional sort of concerns that they may have or they may have observed around using their professional curiosity, but actually understanding what the lived impact is for the child as well, and putting that together. And then lots of work's been done through the quality and effectiveness group in terms of audits. So health have fed into that as well, and that's starting to help us develop that data set to make us move on to the next steps of where we need to get to in some of the gaps that we've got. I think we've already touched on the fact that we've mentioned that GPs have a short consultation time, and we understand the limitations within that as well. So we're trying to work around the toolkits that we were talking around, how we can make that more applicable and more beneficial for practices to use that as well, also in addition to midwifery. And just one of the other things I just wanted to highlight was around when GPs are making referrals, sometimes there's a coding system that they use in terms of what they're identifying the referral will be, whether what form of neglect or what form of child protection concern it is. But we're having some identified concerns around that in terms of the data and pulling that. But that's something that we're looking at as well, to try and pull that in to the wider work that we're doing as a partnership.
Okay, thank you, Natalie. I've got just a couple of questions. The peer review sounds really good, actually. I think that sort of bouncing that off and quite a different local authority, but with obviously very similar issues. It's really interesting. And just because Natalie was speaking last, the question about Think Family. So we've talked a lot about the training, and you know, I know that there's training that goes with Think Family, isn't there? And again, that would be a sort of optional training, I imagine. So there is just a question around sort of how, given the pressures, how do we know that health staff are actually taking this Think Family approach? And then the other question really was that there was a time in Herefordshire's sort of slightly murky recent past when fabricated induced illness was an issue that was raised as sort of health members of the health team being possibly over vigilant, and I just wondered sort of how that's been addressed. I haven't heard any mutterings about that for a while, but obviously the sort of an approach has been taken. So those two things, Think Family and the fabricated induced illness. Thanks.
In relation to Think Family, so it's part of the safeguarding training strategy that organisations have in terms of health. I think 2025, there was a new intercollegiate document that came out that said that if you are a predominant, like you're a general nurse who has predominantly training around adult nursing, you are still required to do safeguarding children training and vice versa for children trained nurses as well. And that is helping to broaden people's perspective on safeguarding as a whole. So now that's actually part of the mandatory statutory training that is supporting the Think Family agenda, because the training is now mandatory. So that means that even though you predominantly have contacts with children, you still need to have a number of hours that you need to have had the safeguarding training for adults as well. So it broadens that scope in terms of how you assess a family when you're out, and indicators in terms of safeguarding. So that's around the Think Family. I will have to, can I come back to you on the fabricated induced illness, because I don't have any further information around that, but I can come back. There you go, Rachel can answer that question for you.
Right, so there was a lot of work done across children's and the health colleagues, particularly those from Wye Valley Trust and others. There was some national guidance that came out on about how you identify and address and work with fabricated or induced illness. One of the challenges was that you would get a number of referrals from health colleagues, but the national guidance made it really clear that if there is a perception that a family is having some challenges, or there is somebody who is inflicting induced illness on a child, there needs to be a lead paediatrician who does an independent chronology of all the health appointments and contacts, because what tends to happen is there is a lot of contact with a lot of different health professionals, and some families from a national review said that they were told that they couldn't attend, and then that would be marked against them, but actual fact they were attending another appointment with another child. So it was the complexity of the situation. By getting a secondary paediatrician to do an independent review of what was happening, say for example, just for an example here, in Wye Valley Trust or across CAMS and others, it allows them to be able to see the practice which is then happening. So the focus of that independent review was that the health colleagues needed to come together so that they could coordinate appointments, so they could give families support at the earliest point. Since that new practice came out and was delivered across the partnership, we've had no referrals for induced illness.
Okay, that's excellent. Thank you. Councillors, do you have any other questions on the peer review? Bearing in mind that we've got the item 8, which is the Peel report, just to look at, and also would you well, finally, questions. Does anybody have any questions about the peer review? Councillor Hitchner.
It's probably a more general one, if I may, and my colleague Councillor Highfield will be delighted that I'm asking this particular question. So I think it's fantastic. You're really working together, three bodies, as it were, and you go along to Birmingham, or go along to some meetings, and you're the only one where 3 parties sort of turn up. It sounds absolutely fantastic. So don't take my question as a criticism, please. You're all in organisations which are having to save money, and there's this great opportunity at the moment. You know, if we had a bottomless pit, it would be fantastic. You could be doing all sorts of great things, and I hear you saying all the great things you're going to do, but the costs are, you're all under huge pressure to reduce your costs. So, have there been any circumstances yet where there's been a conflict because you cannot do, one partner is asking another one to do something you can't, in all honesty, do it. You're having to have a real honest conversation and say, no, that's not going to be possible. And if that conversation is not taking place at your level, further down in the organisation, are there those sorts of conversations having to take place? Robert, was that a fair question?
Yes.
I think we're all going to agree that the new challenges for multi-agency child protection teams have been challenging across us all. We've all been working together a while now, and so can have those challenging conversations, and are having the challenging conversations. In fact, me, Natalie and Emma Brattain from Worcestershire were having a joint challenging conversation. The challenges of the new expectations from the government also bring more challenging conversations, but at the end of the day we have to, I mean, you'll talk yourselves, we have to provide it, and we have to put it into practice. So it's great that now within Herefordshire and across West Mercia and Wye Valley that we are able to have those challenging conversations and come to a resolution, not always on the same day, but we will have a resolution on some days. I think it's more difficult if I think back to 4 years. 4 years I came to Hereford and you couldn't have a conversation at all, or people wouldn't turn up to meetings. But we have saved money where we can. We've supported each other where we can. So police helped us, we helped police. We're all in it together, really, and we're all there for the families, aren't we? So if there's a challenge, we pick up the phone. If there's, we can help and support. The minute that the police got their notification, both Tina and I were contacting, saying, is there anything that we can do to help? How can we support? And if you've got some data, so you don't hold some data, we can provide it. We don't hold some data, others can provide it. You've got to find a way of using the resources to the best of your ability. And where we start concentrating on getting the best outcomes rather than the best value for money, it's about outcomes for kids at the end of the day. And that's what brought children's budget on target. It's what provides the better services. It's about making sure we can do what we can with what we've got. But if a child needs something, then we need to provide it, and that'll stop it further down the line. is. But you can say, you can disagree with me.
I was going to say, does anybody else want to comment on that?
Okay, and I think also that that issue about early intervention, early help, I think that that is felt across the partnership, and that that's understood, that actually in terms of value for money, if you can provide that support earlier, you're going to avoid the catastrophes that we've experienced. Thank you very much. I think we've pretty comprehensively looked at neglect. I don't see anybody else with any other questions. Can I just find out, are you desperate for a break, or shall we just move straight into the update on the police effectiveness, efficiency and legitimacy, the Peel report? Okay, a 5-minute break. So if we come back at 10 to 4. Yep, thank you. Can we stop the live record? Thanks. can we have the live recording? Thank you. Okay, so we are now at agenda item 8, which is an update on response to the Peel inspection findings. And if you'd like to speak to us about that, please, Superintendent. Is it Detective Superintendent we call you? Detective Superintendent Lowe, thank you.
Yeah, no props.
Yeah.
You can call me anything, to be fair. So to give some context then, in 2024, West Mercia Police had its Peel inspection that was, so they go in tranches, so it was 23 to 25 inspection. And the forces issued areas for improvement relating to protecting vulnerable people, specifically the force's ability to identify risk, assess safeguarding referrals and make timely and proportionate referrals to statutory partners. HMIC identified backlogs within the vulnerability hub, variability in referral quality and inconsistent secondary risk assessments that led to the force not being able to reassure itself that it was reducing the risk of harm to vulnerable people, and that's children and adults. Then during 2025, HMIC came back and determined that the force's response to safeguarding was inadequate and it hadn't improved how it managed safeguarding referrals since the previous inspection. As a result of that, in September 2025, HMIC issued West Mercia Police with an accelerated cause of concern that required immediate remedial action with close inspectorate oversight. So the recommendations that they made to West Mercia Police were to make sure that it understands the risks that backlogs pose to vulnerable people, their families and to offenders so that it can appropriately prioritise referrals, work with our statutory partners to create and implement a plan to clear the backlog and make sure it assesses referrals without further delay, put in place a governance structure with oversight from senior leaders to promptly identify any increase in safeguarding referrals, work with statutory safeguarding partners to assess the vulnerability hub's capacity and capability to create a sustainable safeguarding referral system, and make sure that officers and staff working in the vulnerability hub have the right skills and training to make prompt safeguarding referrals that help manage and reduce risk to vulnerable people. So the issues that we identified following HMIC's inspection was that there was a referral backlog back in September 2025. That was significant, and that the risk was not sufficiently understood or prioritised. There was a manual and fragmented police and partnership process. That's across West Mercia, so not just with Herefordshire. Inconsistent quality of frontline risk assessments. There was not insufficient capacity within the vulnerability hub. And there was a lack of real-time performance visibility. So we've worked hugely on all of those areas. So in terms of governance, the force has a child protection governance board that's chaired by our detective chief superintendent, that feeds then into the force's strategic vulnerability board that's chaired by our ACC. So urgent measures were implemented and overseen by our chief officers. So the force introduced a surge capacity into the hub so that it pulled officers from other areas of policing and dropped them into the hub. That created its own issue in that they were untrained, so we had to get some rapid training into those staff. We also now produce analytical products. So at any given time, I can go into spreadsheets and I can tell you what the workload of the hub is, how many referrals they are processing and how many we've got left to do for that day, and if we're going to carry a backlog into the next day. So I have that visibility. What the force does is then it produces a weekly performance assessment for vulnerability. And amongst other things, the hub has a number of slides within that so that chief officers can see how the hub is performing on a weekly basis. So we also produce products. So the spreadsheets that I talk about, those products ensure that crimes of the highest risk are processed first by the vulnerability hub. And a lot of the backlog was in Worcestershire actually, and so we did a lot. That's a lot of our work is from Worcestershire, and so we prioritise those backlogs to get those down. We also track the force's response to risk assessment. So I talked to you about the AWARE campaign that's been running for about a year now. that looks at officers capturing the voice of the child when they go out to incidents and where there are children there. So we made certain offences mandatory, so you must do a child risk assessment if you go to any of these incidents. There is no ifs, no buts, you must do it. And then there were a secondary a section of offences where we said, right, there's professional curiosity here. So you need to think about the child, think, you know, the circumstances that they're in. Are they safe? Do you need to do a child risk assessment? And then we track missing child risk assessments. That's done daily at 6 a.m. every morning. A report is generated that will say to the force, these are the mandatory incidents that you have gone out to where a child risk assessment is missing. That report is tracked through each of our daily management meetings so that we ensure that those child risk assessments are done promptly. We have done lots with our partners, including Assistant Chief Constable led briefings with the Directors of Children's Services. So we have worked really hard on producing, because we were operating in 4 different ways across the force, depending on which local authority we were engaging with. And that's really confusing for staff to sit there and think, okay, which local authority is this, right? What do I do for Herefordshire? What do I do for Telford? So we've worked really hard with our partners in children's services to try and bring together one process of how the Vulnerability Hub will operate with children's services. And that's not finished yet, but we are on draft, I think, 3 of a memorandum of understanding that's very, very close to being finalised now. So, and Tina and Rachel have worked really hard on us with that, correcting my grammar and use of language. So we've had a dedicated process analyst embedded into the hub that looks at processes to help inform that MOU. And look for waste within the system, the things that we're doing where we're double keying, where we don't need to be doing that. And the result of that is a power app is being developed and hopefully it's been delivered in stages, but we've been trialling it with Herefordshire around information sharing requests. And it's a system that automates some of the work for the police officers, so they're not having to go into various different systems. It pulls it together for them. So we're trialling it around information sharing requests. That's been successful, and we're looking to roll that out across the force. But then we are looking at how referrals, so when an officer makes referrals, we will use that same system, and again for Op Encompass. And what that Power App will give us is a wealth of performance information that sits behind it. So in Herefordshire, we can say how quickly we respond to an information sharing request, from the point that it comes in from the local authority to the point that we then look at it and deal with it. Just looking through my notes. So in terms of training for the staff, all Vulnerability Hub staff and those that are seconded in have received refreshed MASH and safeguarding training, and we brought in an expert from another area to help us to deliver that training from an area that's recognised. We've also invited our partners in. Herefordshire have been in really helpfully, provided a member of staff for a week to work with the teams to talk about the Herefordshire way and how Herefordshire respond to child abuse. We've also had health in and other partners from across the board. So I think I've talked about that, talked about the child risk assessments and how we track them. We also track our strategy discussions, so we look at how quickly we respond to those and what the outcome of those were. So that's where we can start to see the 50% increases in joint visits with Herefordshire. So a learning needs analysis has been done, which we will continue to work through with our teams. I've talked about the digital enablement. So where are we? We dealt with the immediacy of the backlogs quite quickly, and we are now in a position of continuous improvement. So we can very quickly see if we've got a backlog rising, so it never gets to that point that we were in September 2025. And we've got systems in place to be able to deal with those swiftly. We continue to work openly and transparently with our partners and HMIC. They're back with us next week, in fact, with a clear focus on sustained improvement. So it's ongoing, but I think it should always be, for child safeguarding, an ongoing improvement journey. But I think the force is demonstrably learning and adapting and trying to modernise in terms of those technical solutions that can help police officers and staff and our partners to respond to child safeguarding issues.
Great, thank you. So I guess my first question would be sort of when, what is the next stage in terms of the inspection process? And then probably my second question would just be to say, how can the partners sort of evidence that the system has kind of moved away from the kind of crisis recovery into a consistent safeguarding practice that has the children of Herefordshire at the heart of it. So those two questions that I'll start with, and then I'm sure councillors will have others.
So I think in terms of next steps, I mentioned HMIC are back with us next week. So in terms of the accelerated cause for concern and the recommendations, we've invited them back to say we think we've met some of them. So they're coming back in to re-inspect from on Monday around some of those. Things like the Memorandum of Understanding that aren't signed off yet, they'll get the draft of it. And if we can get it signed off this week, they'll get the full copy of it. But we've also had announced that West Mercia will have its National Child Protection Inspection by HMIC in July. So we are currently in the data gathering phase for the NCPI. 13th of July is that inspection. In terms of multi-agency reassurance of the system, so what we're able to tell our partners is whether there's a backlog. In Herefordshire, there isn't. And we do multi-agency audits. So we will, through quality assurance groups, we will look at different things. So we've looked at what we will call those cases that the police file without referring to partners. So we've looked at those as a partnership to say, is that decision making appropriate? Because of course everything else, children's services see it, and there is ongoing work around the police sending it at the right level so that it goes to the right place. And I think there are always those conversations where perhaps the police will say, no, well, we do think that is that level. And it's really helpful then to have multi-agency discussions around those cases, isn't it? So that it's understood from each agency's point of view. But I think that's how we reassure ourselves.
There are also floor walkers in the MASH, so we still retain a presence from the Vulnerability Hub in the MASH. Although it was a very challenging time for you during the changeover to the V Hub, by providing support, it means that those relationships between those officers as well as children's services within the MASH increased obviously and became better, so those conversations can take place. There are audits across MASH, so the MASH operations group reviews those contacts and referrals that come through, or referrals and referrals as the police call them, but we call them contacts and referrals, and then they do dip samples. They dip sample where we've had 2 contacts and were they correct. So we look at those each month. There's 25 or 26 in the last month, so they'll dip sample those. So I think there is good connectivity, and sometimes we'll say, are you sure there isn't a backlog? And then it can happen so quick. So I'll send a note to Leanne, or Leanne will send, can you just check? And then that's how partnership works. I think is a much more positive and strong way of working.
Thank you. It certainly sounds like that increased partnership working has made a significant difference, and I think having that memorandum of understanding between did you say there are 4 different DCSs involved in that?
Yes, so the 4 local authorities of West Mercia are Telford and Wrekin, Shropshire, Herefordshire and Worcestershire.
Okay, so that seems like that will make a significant difference if you're not having to operate 4 different systems.
Yeah.
Right. Councillor Cornthwaite and then Councillor Proctor.
Oh, I'd love to ask you loads of questions, really, because it's a fascinating topic that you brought up. I didn't quite catch what took a police officer into the home where you would start that assessment. Is that would that just be a routine visit to a home, and a police officer is then trained to look if there are children around?
Yeah.
Then the great, I tried to imagine a chart of where you would put what percentage of priority would go into this, which I would consider a very important area of police work. But it wasn't an area of police work that I was aware of as an MOD police officer, which I was for 17 years. And if I'd gone into a home, I don't think I would have been thinking about any of what you'd said. And it might have been that I wasn't going into homes where that would have been an issue in any case. Is that quite a recent development? But where does it fit in the whole scheme of all the police work that is needed?
So we talk to our police officers about every incident they go to, consider are there children there. So they might make an arrest for drink driving. There's a child in the car. That's a child risk assessment, please, into the vulnerability hub so that we can talk to our partners about that in terms of any ongoing risk to that child. So it can be any incident that they go to. If there's a child there, we ask them to be professionally curious. Are the children safe? Do we need to do anything? And that's what they do. And sometimes we get told stuff that perhaps we don't need to know, but I would far rather that than them miss a child at risk. So that what the hub will do is it filters stuff. So it will, and for instance, they'll tell us that a child had their bike stolen. Well, if there's no other safeguarding concern, Rachel and her team don't need to know about that. But if, what we say to them, if a child had their bike stolen, they're 9 and it's 2 o'clock in the morning, then absolutely we need to know about that, because that child is 9 years old and out on the streets at 2 o'clock in the morning. So that's the kind of conversations that we're having with staff across West Mercia.
And within the budget or priorities within all the police work, where would you think?
Where child safeguarding sits, I think it's well up there. So the chief constable sets his priorities, and child safeguarding is of course a priority for West Mercia Police. That's evident in the amount of resource that has been put into the hub and the amount of effort that has gone into making practice so that it's safe across West Mercia.
Councillor Proctor.
We asked for this item to come, I think, expecting to be reassured that the police force were on it, and I think you have reassured us of that. And obviously, selfishly, we're only focused on children and young people in Herefordshire. So I guess my two sort of related questions are, if this improved practice continues, what should the children of young people of Herefordshire expect to see as a result? What sort of tangible benefits might happen, and also what are the risks? Because obviously this is a change to the system. So, what are the key risks that you see, and how are those being mitigated?
So it's tricky to think what will the children of Herefordshire see and feel, because what we hope is that the vast majority of children in Herefordshire don't ever have to come across the police or children's services, because they are living their lives, as they should be, wholly and fully. However, for those children who are in need of additional help, what I hope they see are police officers who arrive and provide that help where it's needed, and that West Mercia Police engages our partners and that we work as a partnership to safeguard those children appropriately, and whatever measures that family needs, that they receive them. I think that then, when you're never going to have it where police officers aren't getting involved with families, because that we're an emergency service and we go out to all sorts of stuff. But what we want is police officers who are trained and can see vulnerability when it's in front of them.
And just on that, so obviously in terms of social care will be involved with families for longer periods, and obviously police might be involved in that. But we have developed kind of processes where we go back and ask families and children questions about how they experience that. So is that something the police would do in any of these contexts?
So we haven't at the moment. It's stuff that we've talked about, but we haven't at the moment. I think we need to get ourselves through, this bit first, and then look at, talking to families potentially. And we've talked about, families in Herefordshire and how we can engage around how was the service from the police. However, it's not always a popular response, is it, from the police? So, don't know how better to put that, really.
I mean, I think we might consider making a recommendation that you do think about that, because I think a constant refrain from this committee is making sure that all public services are listening to the voice of children. So I don't think our recommendation will be more than yes, please do that.
Oh, I was just thinking that actually the QA process is, I mean, because you've got such a strong working partnership now, I imagine that the QA process will be picking up these. So the what is the impact of these changes that should be picked up through the QA process? Is the voice of the child being heard through these that again should be picked up? Am I right in thinking that, Rachel?
Yes, so we do the triangulated quality assurance process, and one of the questions that are asked to families is, how do you think the partnership worked well together, and is there any specific area that you felt didn't? And we have not, up until this point, and I can go back and cross-reference, but identified that the relationship with police for families has been a challenge in any way. There has been other areas where it's been picked up, but not specifically for in our feedback. But I will go back and cross-reference and come back just in case. But my view is, and I'll send a quick note now, is that there has been no challenge with families' feedback on the police, and families will give it.
Thank you. Councillor Highfield?
Yes, thank you very much. Press the wrong one. Two green lights, what does that mean? Oh, there it goes. Okay. Just to quickly answer Councillor Cornthwaite's problem, the police officers taking action when they see something wrong in a house or on the street is not new. As a constable in Surrey in the early 70s, on 2 occasions I had to call social services for a problem with children that we didn't expect until we arrived at the scene. So it's been happening. Hopefully nowadays the training and the resourcing is better than it once was, but it's always been part of police work to identify things like that. What I wanted to ask you about is that you mentioned that it's chief officers who set the priorities and decide the resource allocation. But of course, there is a political aspect to that. Unfortunately, the way this country is set up, the police and crime commissioners who set strategic direction are politicians, and they respond to public pressure, which is sometimes ill-informed. I won't ask you to comment on whether you think the resource allocation is correct or not. That would not be something you'd like to answer. But do you accept that there is a danger that if pressure comes from the public, that is likely to influence the amount of resources allocated to a particular problem? And I say this in the context of the fact that on our roads in Herefordshire, people are getting killed in traffic accidents. I've got a parish who complained to me last night that in 2 years they have not been able to arrange a crime prevention briefing, even at any time of the day or night. It doesn't seem to happen. We've got a lot of pressure on the police, and as a retired police officer, I know what all those pressures are. Is there a danger that politics will incorrectly guide resource allocation? Or don't answer. Say I won't answer it if you like.
I'm not going to answer that, but I think that's, the challenge for the Chief Constable is to make sure he's got his resources in the right places to deal with the issues at hand.
Yes, it is, isn't it? Sometimes in the face of what the Police and Crime Commissioner says.
I think in light of your inspection that's coming in July, it might be really helpful to get a report back in 6 months, just as to sort of how these changes are embedded, how that inspection has gone, just an update really on how this is working. Because it sounds, I mean, going through a difficult time for an organisation brings out many of its strengths by the time you're sort of coming out of it. But I think it's important to know that kind of that renewed energy and has actually embedded good practice within the organisation that's actually sustainable and not just there because you're sort of at a crisis point. So it would be helpful to have that if possible.
Yeah, no problem. The National Child Protection Inspection, that looks at how policing deals with child protection right through policing. So it's a big inspection for the organisation. So it goes beyond Vulnerability Hub. I think that the accelerated cause for concern, absolutely. I think we'll be able to come back in 6 months and give an update. And if we've got the report back on the NCPI by then I can give an update on that too.
Yeah, thank you. That would be great. Councillors, do you have any other questions about the Peel
Just a
inspection?
quick one. I think I was a bit like this when I was talking to Tina the other day. There's a lot of acronyms in all this description, and I don't understand what all of them mean. Is there a source of guidance as to what all the acronyms mean somewhere? Either of you could answer that one, would be helpful.
My apologies for that. That's the police officers were dreadful for it, aren't we? We are terrible. And I transferred forces and I got here and I thought I didn't know what anyone was talking about. So I will provide you a glossary of the terms that are in there. Thank you.
Okay, Councillor Hitchner.
Yes, in mixed in with what I am going to say, there may be some questions. But I thought it was a great presentation. Thank you ever so much. It's really nice to hear the great progress that's been made. I do remember several years ago going to a meeting with related to the police, and it seemed the police were kind of protective about their information. And I think the picture you have painted is very, very different from what was in the past. So it's great. I'm interested you're working with 4 councils. So Telford and Wrekin are acknowledged as being a really well-run council, and perhaps the question might be, what learnings do you think, we like to think we're now very good as well. So you've got 2 councils which are kind of top of the game, trying to improve and everything. Are the other 2 some distance away from that? Just that you obviously want to come across a positive way of responding to that. MASH, I think a number of councillors have concerns about police officers no longer being present in the MASH. Rachel, you mentioned about them still walking the floor. I don't know whether are they still are they now back in MASH? So okay, that's another question. We don't want to be slipping back. I think we talked about coming back and what are the kind of risks. We talked about the lack of finance and that kind of thing. And my final point was just we recently had the Child Friendly County meeting down at the Shell store. Leanne, were you there? That was fantastic. I think I was told there were 2 quite senior police officers there in the audience, and I think it's fantastic that you showed support for that. So thank you for that. So in amongst that, a couple of questions, but I think you're doing a great job. Thanks very much.
Thank you. I've lost track of the question. I'm sorry, Councillor. What was your main? What would you the answer?
Well, the one question was about MASH.
So MASH, yes, we've got floor walkers that go into MASH every day. So there is a presence there that's able to deal with quick time issues that come up, and also to give that the face of the VHub essentially.
Great. I don't know whether the current administration want to put we haven't kind of, that's new information to me, and it may be new information to other councillors. So it might be helpful, Rachel, to get some sort of communication out, or you just leave it as it is.
There was a decrease, and now it's there is regular attendance. The other part you raised, Councillor Hitchener, was about the other local authorities. All our local authorities are good, with Shropshire being outstanding. So we all learn from each other. We're all open to check and challenge. Leanne tries to meander between all of us, and there can be lively debates across 4 local authorities. But overall, all of us are good, and all of us want the good outcomes for children. So it's about where we can share, we do. Where we can make that difference, we do. And where there's conflict for purpose, then we will.
Risk there might be in slipping back. You know, we're doing well. So, but I think probably coming back in 6 months' time and giving us further report probably covers that
And
all
I
off.
think the forced scrutiny that is wrapped around this now is there to reassure that we don't slip back, so that chief officers, I've said, on a weekly basis can see the performance of the VHub, amongst other things around vulnerability, and to be able to reassure themselves that there isn't a backlog developing.
I can also confirm from colleagues there's been no challenge regarding police in any of the feedback, and we contacted 100 families. We've got no challenges about the police.
Thank you. Councillor Proctor.
Just very quickly, this is really a sort of internal thing, but the issue, because the VHub has been quite fast moving, I think councillors in general, we've sort of slightly lost track of where things are. The issue of whether police officers are in the MASH or not has been something that I think members have been concerned about. So maybe we could ask Tina just to include a slide in her next briefing to all members about where the VHub is, and that would probably be helpful. Thanks.
Cool.
Yeah, thank you. I think my kind of last question is that there's a lot of dependence on technology and AI with this. Is there a sort of safety net just to try and make sure, you know, if something goes wrong, that there's human oversight of this?
So we're not quite at AI. Robot process automation is what we're looking at. I never thought I'd say that 30 years ago, but there you go. But also, it's I can't remember the terminology. It's not AI anyway. It's stuff that pulls information, and there is police officer oversight. So what that can do is it can pull a lot of information into one place. An officer needs to look at it, or a member of police staff look at it and assess, right, is that relevant information? And if it's not, they redact it out of the information. So yes, there are members of police staff and officers who review the data.
Okay, all right. Thank you. Yeah, I think that brings us to the end of our questions. Thank you both very much for coming and talking to us about both of these agenda items. It's been really interesting. I think it's a fascinating topic, and great to see that the police are working so closely with the partners, and it seems to be working well. So good luck with that next stage. So thank you very much. Unless you wanted to stay to hear about the recommendations, but otherwise, yeah, thank you very much. I'm just wondering if we need to stop for a minute, just while we quickly look at the recommendations and then go back to the live stream. Is that all right, everybody? Okay, thank you very much. Right, so if we can hand over to the scrutiny officer, please, to look at the recommendations.
Thank you, Chair. There are two recommendations, one each pertaining to the two items on the agenda that we've discussed today. The first one concerns the neglect strategy. I'll read the recommendation out. For the Integrated Care Board to consider an adaptation of the Graded Care Profile 2 antenatal toolkit for use by midwives.
Okay, do we just vote on that one now? Yeah, everybody in favour?
Okay, and the second recommendation concerns the update on response to police effectiveness, efficiency and legitimacy, Peel inspection findings. And the recommendation is that West Mercia Police should pilot mechanisms to hear from children and families in Herefordshire with whom they have worked to understand and improve their practice.
Thank you, everybody. Those recommendations have been passed. Thank you very much. Right, so the item 9 on the agenda is the work programme, and to consider the work programme for the committee. So I've had a look at that. What we feel is that it would be good to put this, put a report back from West Mercia Police onto the work programme following their safeguarding inspection, and we can get an update on what's happening with the progress on the Peel inspection. So if we add that to the work programme at some point, that would be good. Does anybody have any issues they want to raise about the work programme? One thing that I saw looking at the forward plan was about the pupil referral units and the spend of capital allocation to relocate the PRUs into a single site. And I thought that it would be good to bring that item onto the agenda when we look at alternate provisions. So just an update on the pupil referral units. So if we can add that.
Yes, Chair, I'll add that along with the suggestion that we've just had now. I've just published an edition of the work programme for May, so it will appear in future editions from June.
Okay, that's yes.
Yeah.
Oh, two questions. Questions.
Do you know when that decision is going to be made about the PRU? Because I know it's on the forward plan in some way, but October it might have already been decided. I just don't know the status of that not being in the administration.
I saw something on the forward plan. I thought about June actually, but we can double check that. Maybe that. So I'd need to go back through the forward plan. Do you want that now? Do you want that answer now? We can have a look at the forward plan. Councillor Proctor, what was your question?
Just what came up in the conversation that I thought would be interesting to pursue is this question of kind of the role, seeing some of these problems through a public health lens. I think we'd have to do a bit more work to think about what does that actually mean in terms of scrutiny, but I think we that should at least drop onto the topics for future scrutiny, and I do think it would be worth thinking about whether that is something we can usefully do within the timescale left for this committee.
Okay, well, we can. I think it would be a good idea to add that onto our long list, and then we can sort of have a look when we do a work planning session at sort of how best that would fit in. So if we can add that to our long list, please, if everybody's agreed with that. Just to go back quickly to the PRU unit. So Cabinet Member Community Services and Assets decision maker due date 4th of June 2026. As far as I understand, but we can contact Quent and me about that and find out more. Okay. So if we can put that as an action to do that, please. me see. Just looking with regard to the work program. So obviously we've got the task and finish, which is we're nearly completed. It's been really interesting looking at early help. One of the aspects of that, we looked at venture and the work that they do in terms of early help as a commissioned service. There has been some publicity around the departure of the former chief exec and founder of Venture, and just to say that Councillor Proctor and I did actually have a meeting with John Roberts, who is the acting chief exec of Venture, just to clarify some of the issues around that staffing, and we were assured that the well-being of staff was really, really important, that staff were recognised and valued. We felt that the organisation had a good handle on the issues that had been raised by staff. So I think I'm fair to say that we got that assurance that sort of workplace culture was of an absolute priority within Venture, and that they were addressing all of the issues as best that they could, and that the impact on the services that were being delivered and the staff that were delivering them was actually being addressed. Would you say that's a fair assessment? Thank you. Any other points to raise? Yes, Councillor Highfield.
Just a quick one. In the next month's programme, All Age Access to Play and Open Space, just to note that under the new public realm, green spaces are going to be in-house. So we just to make sure, we've got a list of names of people who should be talking to us about those things, but just to make sure whoever's looking at that part of it is able to say, as part of that maintenance of open spaces, we're making sure that the access for all ages is still okay. Just to note, because it's a slightly different structure than it was before.
Yeah, can confirm that. I think we've listed Ed Bradford, and I think he's very much the person that we'd speak to in the first instance on this.
Anything else? We've noted, we've agreed the committee's work programme. We've looked at some tweaks to that. To note the work programmes of the other scrutiny committees and the forward plan, we've done that as well. So I think that brings us to the end of the meeting. The next meeting is on the 22nd of July. It says here 10 p.m. That's a bit late. Okay, 10 a.m., 22nd of July. So thank you all for attending. Thank you for your contributions. If I can ask that, unless you've got any formal business, can you please exit the Plough Lane site? I'm formally closing the meetings. Please ensure you've taken your personal possessions with you. Any hard copies of agenda can be handed to the clerk. And can I confirm we're no longer recording?